Fantastic question. So early contractures are a very different animal than later contractures. Early contractures, the causes are really the same thing that you see for later contractures, and it's going to be hematoma, or a blood collection, an infection, a biofilm, a low-grade subclinical infection, or a ruptured silicone implant, because the internal silicone is irritating to the body. Now, a ruptured silicone implant is not a common cause of an early contracture because it's really rare for implants to rupture right after surgery. This is a problem that typically happens years out. It's not something that happens right away unless there was some kind of misadventure at the time of surgery, which is rare. Now, a hematoma is not a common cause of contracture, but it is a more common cause, in my experience, of early contractures. So you know you have a hematoma because one side gets very large, and you will be bruised, you will have more pain on that side. And this is one of the reasons why I'm a big fan of not just letting it resolve on its own. Although some small hematomas will go away by themselves if you just give it enough time, it puts you more at risk for this type of complication, as well as having other issues like the pocket for your implant becoming too large, more implant malposition. You can have stretching and distortion of the tissue, so your symmetry is not as good. I'm a big fan of hematomas, even of smaller size, being evacuated or removed. So in general, if that happens to you, your doctor will talk to you about options because, of course, it's an additional surgery and will be an additional expense to you. But I do think it's a better idea because it can prevent this complication, which can be really expensive. Now, the other potential reason would be, of course, biofilm. And so when I interview patients that come to me for correction of this problem, they usually will report to me that they had some kind of infection early on right after surgery. So several weeks after surgery, they had redness, they had drainage, they had a fluid collection, they were treated with antibiotics. And that's kind of the classic story of someone who develops a biofilm on their implant and then has an early contracture. So you'll hear different opinions from different plastic surgeons. In my practice, I just don't think you're ever going to get away with non-surgical treatment. I think that, especially early contractures, you are going to end up with surgery. Now, there's things that you can do, medications you can take that if you start very quickly after surgery, they can slow things down. There's some evidence for this. So large doses of vitamin E, the medication Singulair or Accolade, and also doxycycline, which is an antibiotic. And so obviously that one is started for biofilm. So I'm not a big believer in the medications for stopping a capsular contracture. I really have not found that they're very effective, but it's certainly worth a try because you're not going to go in surgically to fix something right after surgery. You do need to wait for the scar tissue to soften and the initial healing to happen for the first couple months to make the surgery easier to do. You'll have less bleeding. It's just a safer procedure. So you're waiting anyway, you might as well try something. Now, some people use this thing called Aspen, which is an ultrasound device, and they think that it helps treat contracture. I am a firm believer it does not. And I will do a video because they sent me some promotional material with just the most ridiculous before and after photos. They were like before and after surgery trying to say that it was the Aspen device. I don't think it works at all. They tend to tell you that if you use it early on that things will soften up. Well, it does that anyway. That's just the natural course of healing and remodeling of the collagen. So I don't think that thing works. If you want to pay the money for it and you have the money, then, I mean, sure, try, but I wouldn't recommend it. So you're also going to hear a lot of different opinions on how the revision surgery is done, and that's a whole nother video because this is already getting to be a long video. I have in my revision breast surgery playlist, I do have some capsular contracture videos. And I just want to throw out there, if you are someone with a capsular contracture and you're looking for treatment, I'm involved in a clinical trial with the FDA for a product that is trying to get approval for an on-label indication for capsular contracture. So if you're interested, you can contact me in DMs and I'll let you know about the study.